I'd like to take this moment to welcome everyone to this town hall webinar. We're going to have a discussion today about testing, about campus readiness and prevention measures, as well as answer some Q&A that's come in, as well as those that will submit via the Q&A function in the Zoom. And I want to thank my colleagues and teammates here from campus who have joined me today. My name is Brian Young. I'm the Vice President of IT and a member of our prevention work group here on campus. Dr. Horton.
Hi, everybody. My name is Heather Horton. I use she, her, hers, and I'm the Acting Director of Student Health and Wellbeing.
Hello, everybody. I use she, her, hers as well. My name is Bethany Grubbs, and I am the Director of the Residential Experience. Thanks for being with us today.
And I'm Connie Brockton-Bach. I am a member of the campus.
Connie, I think you're muted.
Oh, I sure am. Sorry about that. I'm Connie Brockton-Bach. I am a member of the campus safety team and also acting as the lead contact tracer for the CC community this year.
So again, welcome to our Zoom. Mentioned we're going to talk about prevention and testing. We're going to hear about quarantine and isolation updates. We're going to hear about the residential experience and move-in, some updates on contact tracing. Also going to talk a little bit about an important piece to our campus community, and that is our community commitment. The commitment we will make with each other as we get through this pandemic. And then, as I mentioned, we'll open this up to Q&A, as well as answer some already submitted questions that came in through email and Facebook. So let me start just by offering to everyone some of the preventative measures that CC has been aggressively taking as we work towards a reopening of campus. These are important steps. A lot of kudos and thank yous to a lot of CC team members who have worked tirelessly behind the scenes to really try to get campus in a position so that we could reopen as safely as possible. Realizing that no solution in prevention efforts or testing will allow us to say that we're 100% safe. So a couple of things that we have done is that we have already taken measures to increase our sanitation efforts around campus. We have additional staff that are working in buildings to make sure that additional cleaning is occurring on a more frequent basis. We have developed kits for departments and areas to use to help aid in our sanitation efforts, including kits that will be placed in areas where in-person class or in-person sessions are occurring. This is an area that I've mentioned before to many of my colleagues and teammates across campus that we all have to help participate in. It's all of us together that will help to keep campus safe and clean. And so by utilizing the kits that are available, making sure that we're helping to wipe down equipment and or things that we might be using, all aid in this effort. Another step that we have done for all of our buildings across campus, and a huge thank you to our facilities team and our HVAC group specifically, who've gone through each and every building. They are working tirelessly to make sure that ventilation and airflow meet or exceed all of the requirements set out to us by state and local health, as well as OSHA guidelines. So again, something that that I think is important to note, because we know how important ventilation is for us in this situation. The other thing I would say is that everybody on campus, students as well as those that would be working on campus, will all receive a packet when they get to campus. That packet will include a series of face masks, some sanitation wipes. Um, it will have a number of things in it that allow for students to be able to carry it with them so that they can wipe down their hands, they can properly sanitize, always have a face mask. So proud that we were able to get our hands on and make these kits for all of our campus community. That will also include a one-time use thermometer, as well as some other cleaning supplies for everyone to have. The other thing I would like to mention is that each of our residence halls will have a series of checkout kits as well for students and others to be able to wipe down and or cleanse their room. The other thing we'll be doing across campus, each of the residence halls, our major buildings, will have temperature check stations to make sure that students can daily check temperature and make sure they're good to go on campus. As we know that increased temperature is just one of several things that alert us to not well. So be on the lookout for those across campus, as well as we have put together through our mobile app, and you see a picture of that mobile app on the slide, for everyone to do and encourage everyone to do a COVID self-check. This will give a series of questions that we have run through our medical professionals that we asked. It's a quick run through, then gives each student a green check that you're good to go, or potentially a, hey, you might want to go see your on-campus health provider. So we're going to be asking everyone to please use that, please adhere to it, and please do it on a daily basis. We've done a tremendous amount of work in our classroom spaces and make sure that they are all set up for the proper social distancing. Given that we're in beautiful Colorado Springs, we're also going to be maximizing our outdoor venues, our outdoor rooftops, our outdoor venues in terms of our quad space to encourage in-person gatherings or classes to utilize those areas as well as the in-building areas for classroom use. And then lastly, I would say that we have done a lot of work to make sure that we are de-densifying buildings and areas around campus so that we make sure that we try to maintain under a 50% occupancy rate in our buildings, making sure that we are able to continue to de-densify so that proper social distancing can occur in buildings as well as on campus. In our next slide, we'll just show you, once you take the self-COVID check, you will receive one or two of these responses. Again, we'll be encouraging everyone to do this specifically as students arrive on campus, asking everyone to do it on a daily basis, including faculty and staff.
And just really quickly, if I can jump on to that slide, if you were to get an entry denied screen, that would be because you endorsed symptoms, had fever, something like that. And if you get that, what we're asking everyone to do is to contact their medical provider. So for students, that'd be the Student Health Center. You're also going to have access to a nurse triage through a UC Health app that we're going to show you in just a little bit. But to discuss with a provider whether you need to get testing. That's really the cue about whether you need to do that.
Great. Thanks, Heather. So wanted to talk a little bit about our testing strategy. I will say that this is our current testing strategy. We are, as like most institutions, being very nimble on this, trying to take into account new tests that enter the market, both PCR and antigen, making sure that we're working with our health provider on campus, as well as our partner in the community, to make sure that CC will have access to the tests as they become available to the community. Don't think I have to mention this, but I will. Testing and turnaround times for tests continue to be a challenge, not just for those of us in Colorado, but across the country. And so we continue to monitor that situation on a daily, if not multiple times a day, with our health partners here on campus and those in the community. So one change that we have determined that we'll be making here on campus is that we'll be testing all students upon arrival. That will start on site with our on-site testing center, which will be available through the academic year and longer if needed. But we'll be testing every student upon arrival. It'll be done in staggered times. Each test takes just a couple of minutes, but that will start on August the 5th. That will continue for the most part through August and September as we start to return students to campus. Currently, been asked through several questions that were submitted. Currently, our partners in health are telling us that our turnaround times are in the 3 to 4 day range. Certainly not as optimal as we would like. We'll continue to monitor that along with our partners to make sure that we can try to get our tests turned around in 24 or less hours. We'll be working with our health partners, as I said, on site and in the community to try to continue to have turnaround times that are beat or exceed the 3 to 4 days. I've been asked a lot about the type of test that we will be using. We will be using the PCR nasal swab test, as I mentioned before. Takes just a couple of minutes to collect the sample, and then the person is on their way. We continue to work with our on-campus science advisory group, made up of very dedicated professionals, faculty members here at CC in biology and mathematical modeling, and in our science areas. They're working with local health professionals, as well as other medical groups that have been set up across the El Paso County environment. They are continuing to refine our random sampling solution that we will look to bring to campus based on a percentage of those that are on campus. They're working with partners across the county as well as the state to make sure it's designed perfectly for the amount of people that are on CC's campus at any given time. So more to come on that, but an important piece to this testing effort. And I also let everyone know that we are simply reviewing options as well of what it could take and what it could be that CC would have an on-site presence for a lab and be able to conduct our own testing. More to come on that as we explore options with both our partners in the health environments, as well as those across El Paso County who are also helping us to think through an on-site opportunity.
So I want to share with you a little bit about how to sort of be ready for all of this testing. And our partner for the testing that we're doing at this point is UC Health. And so folks are going to be able to access that testing through an app. So would encourage you to go ahead and go to the App Store for whatever phone model you have and to download the UC Health My Connection app. And you can create an account there. And we would want you to enter your insurance information. Certainly down the road, hopefully you would not need symptomatic testing, but if you did need symptomatic testing, insurance is an important component of that. And UC Health will be billing insurance, and then whatever insurance doesn't pick up in terms of the cost of testing, then Colorado College would be paying the remainder of that. Another important part of all the testing is that we're asking for everyone in the community to sign a release that would allow your COVID test results, only your COVID test results, to be shared with the CC contact tracing team. Because certainly as we confront this pandemic in the US, contact tracing and aggressive contact tracing, isolation, and quarantine are incredibly important parts of containing the spread of this illness. And I do want to just put out there too, if you or your student is going to be under the age of 18 as they're coming to campus, UC Health will need to have contact with a parent or guardian to consent for the testing and to sign that release for the data to be shared with the campus as well. And I'll pass over to Connie to talk about contact tracing for us.
Thanks, Heather. As I said earlier, I'm going to be leading the contact tracing team. We have a group of very dedicated and committed students who have served and continue to serve on our EMS team, who will be helping to support this effort. We have been busy getting trained and working in collaboration with other members of the CC community, as well as the El Paso County Health Department, to solidify our processes and procedures and to make sure that we have the bandwidth to take on all of the aspects of contact tracing that will need to be supported on campus throughout the academic year. We have identified isolation and quarantine spaces for those students who will need those locations during the year. Again, just to clarify, isolation is a term that will be used for anyone who tests positive for COVID-19, and these individuals will need to be isolated for at least 10 days until their symptoms clear. Quarantine is a term that we will be utilizing to identify people who have been exposed to COVID-19, COVID-19 positive patients, and who have not yet either tested positive or shown symptoms, but will need to be quarantined in a single room by themselves for at least 14 days. We do have a number of wraparound services that we will be providing to students who are in isolation or quarantine, including food deliveries, mental health, check-ins, academic supports, and a variety of other items that they might need while they are in either isolation or quarantine. We will be making daily contact with those individuals and making certain that they have the supplies they need, prescriptions, medication, whatever the case might be. We'll also be setting up appointments for medical check-ins through the Student Health Center. And we will be individually contacting each of these folks, and we'll be acting as liaisons to support them throughout this time frame.
And just to clarify, because I realize that my slide might be a little bit misleading too, that the folks, the providers at the Student Health Center run by Optum, for any student in isolation, which means someone who has had symptoms or tested positive, they will be having daily contact as well. So students will have contact from the contact tracing team checking in with them on a variety of things. And then the Student Health Center will have a medical check-in with anyone in isolation. And that's actually students, staff, and faculty that Optum will be doing that for.
Hi, everybody. So I'm just going to talk quickly about the Movein Experience. And so I'm mostly going to be talking to first-year students here because you guys are the ones that will be arriving first, and some have already arrived. So I did want to articulate that for the move-in date and time, this is a window of an arrival to campus. So since we are now talking about testing, I don't want anybody to panic that they have to arrive earlier than their set arrival date and time. That is now your arrival to campus, and you would go straight to a testing location. This is first years in particular, who are arriving between August 13th and August 17th. And then on the back end, we are accounting for the fact that you will arrive to us, to your hall, to pick up your key after you have completed your test. I also want to let you know that because of some of the messiness that happened around the move-in time slots, I don't want anybody to be worrying or panicking. I am holding back on all of those emails for people who have asked to get a different arrival time or window than they were able to secure during the registration process, and I will be working on those this week. So I don't want anybody to be losing sleep over that, but I will be doing those adjustments for those who absolutely need to have a change due to travel arrangements. And then I know that many returning students have been asking about their time slot sign up as well. So for those who are arriving for back to campus for block 2, we will release those time slots in that move-in registration in a few weeks. I'm sort of anticipating 2 to 3 weeks when we will be able to do that. We just need to get a little bit of a better sense as to how many people can arrive per day, and we really want to combine that with appropriate social distancing during the move-in period, because as we know, move-in periods can be really clustered and busy times in residence halls, and so we really want to de-densify that move-in process and make sure that that everybody is able to sort of have their clear pathway. So we'll be taking a look at that and seeing how many students will be arriving during that time period, how many students we can test at a time, and then figuring out exactly how much we need to space that move-in. I want to give you an idea of what to expect. I think that you all know this, but all staff upon your arrival will have masks, and of course you'll need to as well. And just know that though, I mean, I think that many of my staff are struggling right now with this notion of like, how do I show somebody that I'm really excited to see them and I'm excited to welcome them to CC? So particularly speaking to our new students out there, just know that there's a lot of excitement around having you here and getting you here and helping you to move in. And so look for those sort of twinkling eyes that show that there's a smile underneath that mask. Then I also want to warn you that all forms are electronic. So being able to do those electronic forms prior to your arrival, they should be sent to your inbox. So things that you used to do, like filling out room inventory reports and key check-ins and those forms, those have been taken to an electronic format. So you can expedite your process and really speed along your move-in process if you do those beforehand. We can advance to the next slide, Heather. Then I want to talk a little bit as well about what to bring, and we've gotten a lot of questions about this. So first off, just remember that, and this applies to our new students as well as our returning students, only one guest per student is permitted to help with the move-in process. I've had a number of questions from returning students as to whether this applies to them as well, and it does. So be careful and cautious, and particularly for our new students, I know that there's a lot of two-parent households that really both want to be able to see their student into college, but thank you so much for adhering to this so that we can keep things as de-densified and keep those pathways open as much as possible. Then in terms of what to bring, we have on our housing website under the FAQ, you can see, of course I posted a link here, but you can't really click in a Zoom meeting, but there is a what items should I think about bringing? And those are our standard items, but we wanted to add some safety items to that. And so we want you, as was mentioned, there are kits that will be given to each student that supply a couple of masks, alcohol wipes, a single-use thermometer. I saw a question come in the chat about that single-use thermometer. That is for sort of that emergency purposes of like, oh my goodness, I can't find my other thermometer. Now I can take this, or maybe you can keep it in your bag if you're out during the day and you feel like maybe you've popped a temperature or popped a fever. So we do want students, whenever possible, to be able to bring their own thermometer. And as I think Brian mentioned, there will be touchless thermometers that we can scan you with down at the front desks with the front desk coordinators, but certainly the fastest way to be able to input your information into the app and to get out and about your day is going to be able to bring your own thermometer so that you can use that on a regular basis and keep your hands on it. But if you lose it, if you misplace it, come on down to the desk. And then really bringing cleaning supplies. Another question that I saw come in was if we would be going into student spaces, particularly spaces like the cottages or the apartments, to clean in there. And the answer to that is that we really want students to take the initiative and to take the ownership over cleaning their own personal spaces. So inside bedrooms, but also those shared spaces. So if you think about the large halls going into, restroom, it's great to be able to bring some cleaning supplies in there too, and maybe wipe down handles before and after use. So we will provide a lot of cleaning supplies in those shared spaces, but it really would be great if you have the capacity and the wherewithal to add some of those cleaning supplies, hand sanitizer, masks, and a good thermometer to your list of things that you would bring to college with us or with you. So the last message, and I'll certainly be available for questions as well, and I'm trying to answer a lot in the chat as I see them come up or in the Q&A, but really just thank you for staying flexible and really keeping safety and community in mind. We know that this is a very different way to open up our residences to you, but we behind the scenes have put in a lot of thought and a lot of care as to how we can make this as personal as possible and take as much care of our students as possible, but also really keeping in mind all of those, all the community commitment and everything that we need to do to keep our community as safe as possible. So I'll toss it to the next person now.
Thanks, thanks, Bethany. Just to reiterate a few things that Bethany also mentioned, our ability to be flexible, nimble, that we are empathetic to each other during this time. CC has drafted what we are calling the CC commitment. That is a one-pager, maybe page and a half. What you see on the screen are really the highlights of what we're asking our entire community to do. These are challenging times for sure. And so in order for us to be able to get back as safe as possible, besides the idea of testing, a number of things that we're asking everyone that comes and that is going to be a part of the CC community here on campus to adhere to. These are important components to help to stop any spread, to help to stop any positive cases. So all of the things listed here, and many of which have been talked about, are important that everyone take serious and adhere to. It will just take a few, one even, that decides I want to go out. I want to go to that large gathering, and it's just or unsafe behaviors of any kind that we just want to try to avoid. And so we'll be sharing the CC commitment. The highlights are here on the screen, but that we're asking everyone to again, to adhere to and to practice. So with that, I do want to leave some time for some Q&A and for us to be able to answer some of the questions that have come up in our chats, and also some that have come up through email or various text messages. One I'll ask Dr. Horton to address, that came a couple of times, is that being in isolation or testing positive can be a real mental stress for any of us, especially students. Can you talk a little bit about what CC has planned for just basic mental wellness and well-being of students, maybe not just in isolation or tested positive, but just in general?
Yeah, that is definitely something that we have been thinking about a lot ever since March, when this happened, because mental health is a priority on our campus in general. We've been a part of the National JED Campus initiative. This is our third year, I believe, of the JED Campus Initiative and the Equity and Mental Health Pilot. So these are really strong commitments that we have as an institution to the mental health and well-being of our students. And so, as you might imagine, our approach to this is pretty multifaceted. Certainly, absolutely hear you, being in isolation and even just social distancing, right, is a challenging moment for all of us to figure out. Just like Bethany was saying, you know, I'm used to making eye contact with people and smiling at them, and it's hard to convey those things, and so even just that ends up making us feel isolated. And so there are many things that we are planning to do, beginning with new student orientation, to try to help people to feel connected to cohorts, to groups, and to peers and peer leaders. And so certainly our new student orientation leaders are still going to be a part of new students' experiences and helping to orient them to campus and building those relationships. Bethany's staff in the residential experience also are going to be doing lots, and I'll let you, Bethany, speak more about the kinds of things that will be happening in the residential experience in terms of trying to build community and sense of belonging. But also, do you want to say something about the intentional conversations, and then I'll pick back up with some other things we do for mental health?
Absolutely. So we just started last year moving more from a programming model to an intentional conversations model within our residence halls. And that's how we seek to engage our students and really be able to dialogue with them about their hopes and their goals for college, but also about their well-being and how they're doing, and identifying resources that may be able to help them succeed at CC. And so we are stepping that up even more in this year and saying that, you know, in previous years, intentional conversations, if a student wasn't really interested in engaging with their RA on that, then we kind of said, okay, you know, no worries. But this year, expect that if you're not replying to your RA about sort of getting that intentional conversation on the books and connecting with them, then they're probably going to try a little bit harder and keep trying until they get in touch with you, because we realize how abnormal a year this is going to be, how difficult a year this may be for some. And so we really want to have RAs doing those check-ins with students to see how they are doing, to identify needs, and to help them to be successful. And in addition to that, we will do programming virtually and maybe limited in person within those residential pods. And so we are using all of our creativity and all of our flexibility to find those ways to really help students to connect with one another and connect with their communities.
Yeah, and that's just one piece of, hopefully y'all may have seen In another town hall, we shared our stepped care, integrated care model with regard to mental health, really thinking about the self-care opportunities, the skill building opportunities that students have to build their own resiliency and the ways in which we can support that. And those kinds of programs and events and consultations will continue to happen. Some individual consultations may be happening in person with staff, but lots of virtual opportunities. We have a lot of information available on the web and resources for students, if they wanted to kind of work on, I'd like to build a new stress management strategy, right? There are some of those opportunities already on the web, and we'll be doing programming and workshops on those. Also thinking about if people find themselves struggling, the kinds of resources and many points of entry that are available to students with regard to how they can access resources, thinking about their own strengths and building upon those. And then the counseling center will continue to operate as it has. Most of the work that they do with students is going to be virtual, because truthfully, doing psychotherapy in a virtual setting actually is a bit more conducive than in an in-person masked setting when you're talking about really personal things, to not be able to see each other's faces. And at the same time, there will be counselors who are on campus and ready to meet with students on an urgent basis or for specific kinds of meetings. The psychiatrist who works in the counseling center will continue to have virtual meetings with her patients and new patients for medication and things like that. And we'll continue to provide referrals to off-campus folks as people are needing them. And then we've got 24/7, lots of 24/7 resources on the CC campus that you can access for all of those. And for anybody who wants to see that model, it is available on the Wellness Resource Center, Wellness Resource Center webpage, and you'll see it in an educational module that you'll all be receiving an invitation for within the next day or so.
So we had another question come in. Colorado College doesn't have gates and walls around it. How are you going to limit guests and visitors from being on campus? That's a great question. One of the things that we will be doing is making sure that our buildings are only accessible via our CC Gold Card. And so that will hopefully eliminate non-students, non-faculty, non-staff from being in spaces. We will be making sure those are locked and only accessible by using your Gold Card. We've also put and reminded everyone that we have a no visitors policy that we'll be adhering to for campus. And so trying to make sure that we, again, dedensify campus, keep campus open for students and those faculty and staff that need to be on campus. Had a couple of questions come in about testing and the use of antigen testing. One of the benefits of us having not just our science advisory group, but two health partners, Optum and our UC Health team, is that we are all actively monitoring this landscape of rapid new tests as they come out and available. Both of our partners are actively working on solutions on that front. I can assure you that we will be taking every advantage of new and rapid tests as they come onto the market and become available. That's a key element, as many folks know, that testing and capacity is is stretched thin. And so we are trying to make sure that we can provide rapid and reliable test results. And so both of our partners are, again, actively and aggressively looking in that space to make sure that when they become available for us, we could deploy and use them as a strategy as well.
I saw a question here about with regard to testing for students who have remained with us on campus, who were still living on campus. And all of those students should be getting an invitation or more information about that testing, hopefully later today, if not tomorrow morning, to schedule for testing on our first testing date, which is Wednesday, August 5th.
A couple other questions that showed up around testing. Again, testing location will be on site, on campus, and certainly be accessible around the clock for our students that are here. We'll have numbers and resources that they can also reach out after hours. Heather, can you talk just a little bit about sort of after hours in a test?
Yeah. So during the normal operating hours of the Student Health Center, and you can find those hours on the webpage, folks will be referred there or given appointments there to go get their testing done. And then after hours, through that UC Health My Connection app, you'll access the nurse triage. And if through that process, they determine that you should be tested, for students, they will actually then deploy a testing unit to campus. There is about a 2-hour turnaround on that from the time of phone call to the testing service being in location. And so testing will happen for students up to about 11 p.m. For staff and faculty, you'll access the same UC Health nurse triage system. And during the day, you'd go to the Student Health Center to get your sample taken. And after hours, you'd be sent to another UC Health site for that testing. I did notice there are a number of questions coming in about the insurance piece, so I want to maybe clarify that. Whether students have the CC Student Health Insurance Plan or whether you're on a different health insurance plan, you'll be able to enter your insurance information into the UC Health app. And then UC Health will bill, as you know, medical folks bill insurance providers. And then whatever is not covered by insurance, then they will essentially bill it to the college. So you won't receive an additional bill for that, a copay or anything like that. They're going to bill insurance, and then the college will pay the extra money if there is extra money there.
Couple of questions about where a student that might test positive, where they might go. The campus has done a lot of work around spaces for us to be able to have students if they test positive. Heather, do you want to talk about some of those spaces and also some of the equipment that UC Health and our partners will be providing for additional checks?
Yeah, so definitely we have a number of locations that are quite near campus that have been identified for isolation and quarantine. There are also some spaces on campus that were set aside for isolation and quarantine. And there are some student residences that have a single room and access to a single bathroom. And for those folks, they would be able to isolate or quarantine in place, essentially, in their assigned housing. For other students, if they were symptomatic or had tested positive, then if their assigned housing was not a place that they could sort of shelter in place, so to speak, then we would move them to one of those other locations. And for any student who receives a positive test or is found to have COVID, then UC Health will be making sure that that student does indeed have their own thermometer and a pulse oximeter. So if you're not familiar with a pulse oximeter, it's the little thing when you go to the doctor, sometimes they put the thing on your finger and it reads your pulse and it reads the amount of oxygenation in your blood. And the temperature and that pulse ox are two metrics that are really important for medical providers, really things that they are looking at as they're looking visually at a patient. Having that data is really important for them. And so everybody who tests positive will get those so that they can keep track of that and that the medical providers can check that when they have their appointment with them.
I can jump in real quick. I've seen a few questions come into the Q&A about being able to be with a roommate prior to testing. And so I absolutely want to refer you to the enhanced social distancing protocols, but know that while waiting upon a test, we are not moving students to single rooms. I mean, if a student were to express that they were symptomatic, then certainly we would take it from there. But for the standard arrival and testing period and awaiting results of that test, they can live in their rooms that they are assigned to, and that includes with roommates.
And there have also been some questions about off-campus students and testing. And the answer to that is slightly complicated just because we have lots of different groups of students. So certainly we have some students who are actually living off campus who are going to be doing things like serving as new student orientation leaders or first year program mentors, and those students will be tested. We're going to have a number of testing dates throughout August, and so many of those students may be getting into the testing protocol in those places. And as we move toward welcoming our upper class students back to campus for Block 2, we'll have testing dates that those folks living off campus would be able to access as well, so that we don't have maybe, the entire remainder of our students doing testing just during that move-in phase for folks returning in Block 2, that we could kind of phase that in with the folks who are going to be living off campus as well. And since I'm on the topic of off-campus students, I see a question about the isolation and quarantine spaces for on-campus students. And so in terms of spaces, housing locations for students who are living on campus. Those are the ones who would be moved to those specifically designated isolation and quarantine spaces. Certainly there might be circumstances, right? Some special circumstances, and we would look at those case by case for someone who's living off campus. But in general, for students living in off-campus housing, we would anticipate that they would handle isolation and quarantine, just as, for instance, I would handle isolation and quarantine if I received a positive test or had been in contact with a positive COVID patient. And that is to do isolation and quarantine at home with the best self-protection for myself and my family. And so for students, that would be the protection for roommates and things like that.
A couple of questions about the time frame. Someone gets tested and the 3 to 4 days to get a result. Again, it goes to a comment Bethany made, that we're asking people to adhere to these enhanced social distancing measures. This is, again, an element of this sort of campus commitment that we all take serious, that we are doing what we can to these enhanced social distancing measures to make sure that until we get our results back, that we're not doing large gatherings or things of that nature. So certainly we want the ability for students to not just have mental wellness, but exercise and physical wellness. And so making sure that those things can happen are important, but really asking people to, as Heather mentioned, sort of be cognizant of the fact until your results come back that that you could be positive. So we're asking people to really take this seriously.
And a really important question, someone's asking if someone's showing symptoms, waiting for test result turnaround might be problematic, right, if they've got a roommate. And so again, we're asking people if they are experiencing symptoms to first reach out would be to their medical provider, but to engage self-isolation. And part of that process would be certainly if a medical provider says you need to be tested, right? We're treating that as a probable or a likely COVID positive case. And so we would be working with that student to move them into isolation. And then potentially that roommate who they might have had close contact with prior to the development of symptoms would be contacted through Connie's contact tracing team, and that student might be in quarantine.
Couple of questions, and then I know we're getting towards the end of the hour around parents and families being able to walk around campus after they drop their son or daughter off. Again, we're trying to do as much as possible to de-densify campus and try to encourage, as Bethany mentioned, just a single family member or friend to join the person on move-in. And then to be on their way after that is completed. So we're asking people to help please take that into consideration in terms of your plans. Bethany, anything to add to that?
No, I don't think so. If anybody has any more specific questions to their own family circumstance, though, I do want to reiterate that you can email me at any time. Well, many of us at the college are a little bit behind on our emails. We will get back to you. And so, so if you have questions specific to your circumstance, then just let me know.
Thanks, Bethany. And to each of you, Connie and Heather and Bethany, thank you for helping today on this important topic. I'm sure we'll do more for our viewers out there, for our listeners out there. I do want to just say that having been involved in this along with my colleagues as we work through the landscape that's ever changing with COVID, how serious Colorado College and the faculty and staff are taking this. The safety of all of our community is at the heart of what we're doing. I thank all of you for your thoughts. I've received many on testing and options and things of that nature. I just share again how serious we're taking this, how important it is for us, how many eyes and brains are digging into the best testing strategies and options with knowing what's available and turnaround times that work for a CC community. And it's just something that we are very, very serious about. And hopefully that came across today with the words you heard from our various speakers. I thank you again for your participation, for your questions. I do want to also share that we have an upcoming town hall. We have questions and answers and some updates that folks have had about tuition and billing. And so we'll have two of our colleagues from finance and from financial aid join us that will help answer questions and give a briefing and overview on the flexibility and the options that we have with tuition and billing in the same way we have flexibility with the block plan and our academic delivery model. So please sign up for that. Look for a link soon. And thank you again for joining. Everyone be safe and be well.
Thank you.